Hi, my name is Seya and I'm from the Democratic Republic of Congo. I'm the oldest of four, and in 2006, I moved to the United States to pursue higher education at Fresno Pacific University. After completing my studies, I returned to Congo for the first time in 2015 to visit my extended family in Kinshasa and Kikwit, the city where my parents grew up. During the visit, I met many people and I heard many stories, but three groups touched me deeply: the albinos, the teenage mothers, and people with limited mobility. The albinos shared how they often felt outcast. The teens' mothers told me how they were judged for having children at such a young age. And people with limited mobility said they were viewed as the beggars rather than capable members of the community. The story broke my heart. I could not believe such treatment was happening in the 21st century. I promised myself that one day, if I could do something in Kikwit, I would help these individuals. Fast forward to 2019, while visiting my grandmother in the hospital, I saw firsthand how poorly maintained and unkept the facility was, and how patients were sometimes cared for only if they had the money. I knew I wanted to help improve this situation. Upon my return to the US, I shared my dream with my wife to build a modern healthcare center in Kikwit. Although she was a bit surprised since I'm not from a medical background, she supported me fully. Then in 2020, during the pandemic, mortgage rates dropped. My wife and I refinanced our home and used some of those funds to purchase land in Kikwit and began building a care center. A small but meaningful step toward providing compassionate care and dignity for those in need.
Hello everyone, my name is Cady Lumea. I am also from DR Congo. I came to the US at the age of 9. I've always been aware of the disparities back home, but when my husband, who has never really been into healthcare, came back from his trip and shared how strongly he felt about helping our community, I was really moved. At first, when we started discussing the idea of building an urgent care, I was a little hesitant, not just because of the financial investment, but also because of the physical and emotional demand it will take to manage a project like that, especially from afar. At the time, we were expecting our first child, and the uncertainty of COVID made everything feel even more challenging. But deep down, I had a strong conviction that this was a calling from God, something we had to obey. I believe that God will strengthen the uncertainties and provide the right people and connections along the way. And He did just that. Interestingly, while pursuing my master's in public health, I once had an assignment that asked, if you are the CEO of an urgent care, how would you build and operate it? I had no idea that that assignment would soon come to life in such a powerful and personal way.
Fast forward, friends from Fresno often ask me, what was I doing each time I traveled to Congo? I told them about the vision I had for Kikwit and the dream of building something that would bring hope and care for the people there.
In 2023, some of our friends from our Bible study group encouraged us to create a nonprofit so that others could also get involved in what we're doing. And that's how the Good Friend Ministry was officially launched in April 2023.
I've always been deeply moved by the story of the Good Samaritan. In that story, Jesus challenged all of us to consider who's our neighbor. And once we know, we are called to care for them no matter what the circumstance. I see this care center as a place of refuge for those who have been outcast, looked down upon, and forgotten by society.
The care center is more than just a place for physical healing. We envision it as a space where people's spiritual needs will also be met, a place of love, compassion, and dignity for all.
For those of you watching this video and feeling moved by our story, I want to encourage you to do 3 things.
First, be curious. Take time to learn about Congo, and especially about Kikwit.
Second, pray for us. Pray that this vision will continue to grow and will come to full fruition.
And third, if God places in your heart to give, we welcome your support towards this cause.
Thank you so much for watching.
And thank you for being a good friend.